look down below and tap that subscribe button. We truly appreciate your support. Thank you. Hello, everyone. Welcome to Forensic Friday. I am Shannon, your host. And today we have Erin Eli, and she is a forensic pathologist. Now, there are so many questions I have because so many people think pathologist, medical examiner, forensic pathologist. What is the difference? Well, tonight we're going to find out, and we're going to ask a whole bunch of questions. So, Erin, welcome to Forensic Friday. Thank you so much for coming on our podcast.
Thank you for having me. I'm excited to be here.
Yes, this is like my dream. I am a forensic geek. So I love everything that all of you are doing. When we had Wendy on last week and we had the detective on, oh my gosh, this stuff is so great. So you tell us, you are a forensic pathologist. Explain what brought you to where you are now. Is this, how did you end up what you're doing now? And then we'll dive into what that is.
Okay, sure. I kind of took a roundabout way to get into forensics. I do feel like a lot of people who enter forensic pathology kind of go into medicine thinking that that might be what they want to do. But for me, it was a little more roundabout way.
Roundabout. It just sounds so crazy.
Yeah, I went to medical school to become an orthopedic surgeon. I don't know what, the audience knows about medical school, but during your fourth year, there is something called the match.
The match?
The match. Yep. The residency match. And you apply to programs. They interview residency programs. They interview 2 to 100 fourth year medical students for 2 to 10 positions. You rank all the places you interview at. They rank all the applicants, and a computer system matches you up. So that's why it's called the match.
Okay.
So orthopedic surgery is very competitive. There are more applicants than positions each year. It's also not very friendly to women.
Really? Why is that?
I don't know. It's just traditionally been one of the subspecialties in medicine that, at least when I was applying, I'm not sure how much it has changed since then. It was only about 5% women.
Okay.
So, it is much harder. You have to be even better than your male counterparts. I didn't match.
So ridiculous. But
I didn't match. I did a prelim year of general surgery, which is just a 1-year position where you act as you're just like the other surgical residents. You just don't have a position beyond 1 year.
Okay.
It was not a good year. My program worked many hours more than what we were supposed to do safely.
Is it kind of like what you see on TV where everybody's working and exhausted and no one's getting any sleep and they're doing their rotations and it's crazy?
Yeah, I mean, we were routinely working 100+ hours a week. I didn't like the surgeries because I liked the bones and the ortho. I didn't like the general surgery ones, and it wasn't fun. I think after I did a 2-week stretch of every other day 30-hour call, I was just like, this is not for me. I applied to orthopedics again. I didn't match. I did a research year in orthopedic surgery and didn't match again. And at that point I said, I should do something different.
The gods are talking to me.
Yeah. I actually was kind of probably on a pre-law track prior to medical school. I was a history major at the University of Virginia. I did that. And so I thought, well, I like anatomy. I liked the bone saw. I liked, the bones. And I did like the law aspect that I had exposure to, but didn't want to go to law school after I'd already gone to medical school. So I thought forensic pathology would be a good fit for me. So that's kind of how I ended up here.
Oh my gosh. So tell us the difference between a pathologist, a forensic pathologist, a medical examiner, or if there even is a difference.
Okay. So forensic pathology is a subspecialty of pathology. So pathology is, obviously I'm a little biased, but one of the best fields of medicine. It really is the basis of medicine if you think about it. Pathology is the diagnosis of disease. So in medical school, a lot of times the pathology book is the basis for some of the book learning that you do, because we have to understand both natural body and then how disease affects the body, to then be able to treat patients. So pathology is the diagnosis of disease, and it's both in the organs of the body, but then also in the blood. So a lot of different aspects of pathology include all of those that would diagnose disease. So you have surgical pathology, which is, if the surgeon removes your colon and they send it to the pathologist to determine, is there cancer? What type of cancer? Has it metastasized to your lymph nodes? The pathologist is the one that does that. There's cytopathology, which is if you had a thyroid nodule and they want to know what type of cancer, if it's cancer and what type it is, to determine what type of surgery they'll do. The cytopathologist will come, and he's the one, or she is the one, who will stick a needle in, draw out cells, and determine what is in the thyroid. You also have, hospital pathologists that perform hospital autopsies. And then
What's that? A hospital autopsy?
So a hospital autopsy is something that is, so laws are changing in this country. It used to be that the Center for Medicaid and Medicare, CMS, used to require hospitals to offer patients free of charge an autopsy, or offer families an autopsy for their loved one who dies in a hospital free of charge. In the fall of 2019.
Regardless of the reason.
Correct. The family just, if your loved one dies in a hospital, you have the right to request an autopsy, and the hospital has to provide it for you. Now, that hospital doesn't necessarily have to perform them, but a lot of them would contract with other areas, other local areas, to have it provided. So for example, where I went to residency training in St. Louis, our hospital had a pathology residency. So we had residents, and our hospital was affiliated with several hospitals in the St. Louis area. So all of those hospitals sent their hospital autopsies to our facility to have them done there. But that was removed in 2019. They said it was, an undue burden on hospitals. But hospital autopsies can still oftentimes be performed. So those are typically people who die of natural causes. For whatever reason, the family wants an autopsy.
But it has to be requested.
Correct.
Is it still free of charge, or?
The hospital ones, yes, are supposed to be. Now, there's also, a private autopsy, which would be where your loved one dies at home, and it's not considered a medical examiner case, but you want an autopsy to know why they died. You can have a private autopsy. And then there's also the forensic autopsies.
So what is it when you say, and for you, you're talking just natural language, it's not a medical examiner's case. What makes it a medical examiner's case versus not a medical examiner's case?
So, every state is a little bit different. So there are some statutes for that, but our cases are any individual who dies suddenly, unexpectedly, not of a known natural cause, violently, accidentally. So any of those causes. So obviously, there are a lot of cases that end up being natural for us. We just don't know at the time. Maybe it's somebody who has a history of drug use, but also has cardiac disease, and we don't know, did they use drugs, or is it their heart? Is it a combination? So it gets reported, and we either accept it or we don't. Accidents include motor vehicle accidents, pedestrians struck by a motor vehicle, accidental drug overdoses, elderly individuals who fall and break their hip, that's still an accident, drownings, all those types of deaths. And then obviously the more violent ones with a homicide or a suicide. So those would be ones that come to the medical examiner. And the question that you asked earlier, so medical examiner, forensic pathology, it's used interchangeably. It's basically the same thing. We're considered, we're physicians who were trained in pathology and then have done a subspecialty training in forensic pathology. So the medical examiner or the forensic pathologist is the one who's going to do the autopsy. So the difference between a medical examiner and a coroner, Obviously, I'm a little biased. I prefer the medical examiner system, and we'll talk about the difference and why. So for a forensic case that fits that description, somebody who dies suddenly, unexpectedly, non-naturally, violently, suspiciously, a forensic pathologist must do that autopsy. So like the pathologist at the hospital can't perform that autopsy because they don't have the forensic training.
And what makes it that? What is that level up that the forensic pathologist has that can?
So medical training includes both a residency, which is typically more of a general training. So for me, that was the pathology residency. And then the extra training is, I did what they're called a fellowship in forensics. So it's a subspecialty of pathology. So I did 1 year intensive training only doing forensics, not the other aspects of pathology.
And what is specifically the forensic end of it? Just so people do not understand what that means.
Oh, okay. Yeah. So forensics, it's different in that, I was taught, in your fellowship, you're going to be taught, all right, what is a gunshot entrance wound versus an exit wound? We have to know how to recover evidence. How do you, take a bullet out without creating extra markings on it with your scalpel? We have to be able to understand trauma in a way that's different from other people, because I have to know, okay, this individual, I'm told that this child slipped and has this severe head injury. Does that story make sense? Or is this maybe potentially not non-accidental or inflicted trauma by, one of the caregivers, and, potentially, there's some criminal charges for that. So forensics is, using autopsies to determine cause and manner of death. And
explain the difference between cause and manner. And there is a difference.
There is, yes. So cause of death is, what led to the death. So I don't know, that's not very, let me think of a better way to give that.
It's very confusing for people.
It is. And actually, it's confusing for even regular physicians. Up to 30% of death certificates. So a medical examiner has to sign any non-natural cause of death certificate, or any non-natural manner of death certificate. A regular physician can sign any other natural death certificate. And there's no training in medical school how to sign a death certificate. And it's very
Which is so important.
I know, right? For so many reasons. And as many as 30% of them are done incorrectly. Some states—
That's a lot.
It is. And some states, the physicians are never even notified that they did it incorrectly. It may just go back to the medical examiner and they'll change it. So yeah, so understanding cause, mechanism, and manner is really important. So cause of death is the injury, disease, or combination of the two that initiates the physiological disturbances that, no matter how brief or prolonged, so that's really important, result in the termination of an individual's life. So there's no statute of limitation. I know one of the things that also is confusing for people is that the death certificates have an option to put proximate and immediate cause of death. So immediate cause of death would be exactly at that time what led to the death, and the proximate cause of death would be what is potentially like the disease process that led to it. So for example, somebody has a stroke, you might say the immediate cause of death is hemorrhagic stroke, whereas the proximate cause of death is hypertension or high blood pressure. So the high blood pressure led to the stroke. So the proximate cause of death is the hypertension, but the immediate cause of death at that time was the stroke.
Okay. Now I have to tell you, I would think that is really important to get right, because there's insurance issues. There's a lot that's at stake if that's not right. And to have 30% be incorrect. And then you don't even tell the doctor, whoever signed off. It's almost like you can't even get them to get better at it, because that's just me venting. But wow, because that's got to come back and cause problems for families sometimes.
It does. And where we see it a lot is in Florida, the medical examiners are responsible for cremation review. So before anybody is cremated, we have to ensure that the death certificate is signed correctly. And that's where we're able to find some errors. But obviously, if it's not a cremation, there's potential that things get missed. It's also really important, if you think about it, death certificates get collated by the CDC. That's where we get, this is the leading cause of death in the country. So heart disease is the leading cause of death. That's where people decide to funnel money because, well, if it's killing people the most, then maybe we need to, do more research in cardiac disease. And we make public health decisions based on those numbers. And so it's really important to know that they're done correctly. It's how we knew in 2015 that accidental drug overdoses surpassed motor vehicle deaths as the leading cause of accidental death in the United States. So, there's lots of things we can look at.
Yeah, those that they need to be accurate.
Yeah. So I think part of the problem is, so where people get hung up is mechanism. So mechanism is the physiologic or biochemical process by which the death came about. So that is not included on the death certificate, but some people get confused and want to include it on the death certificate. So examples of mechanisms would be exsanguination. So yes, ultimately, if somebody has a gunshot wound that goes through their heart, they're going to eventually bleed enough, which is the exsanguination, and die. But the exsanguination is not on the death certificate. That's the mechanism of how they died. The gunshot wound of the chest is the cause of death. Ones that people use all the time, cardiopulmonary arrest. Well, everybody dies when their heart and lungs stop. Yes. Brain death. Yes, everybody, essentially becomes brain death, their heart and lungs stop. What caused that? And I think the challenging part is that sometimes, so to truly understand cause of death, you need to understand the mechanism. And sometimes in natural deaths, we don't 100% know the mechanism. So for example, if somebody dies suddenly of a cardiac issue, or a pathologist to say that it was actually a heart attack, that person needed to survive at least 4 hours. So the only way I can say for sure that it was a heart attack is that I need to see certain cells come into the heart muscle and they don't show up until 4 hours. And a lot of these people, right, are going to die suddenly. So I can't say that it was for sure a heart attack. Another thing that could have happened is that they have, cardiac disease. So they either have high blood pressure, they have something we call atherosclerosis, or hardening and narrowing of the arteries. And they have a history of not enough oxygen to the heart. So they have something ischemia, and they have scarring in their heart. So then their heart is more prone to just have an atypical rhythm, meaning an arrhythmia, and that also causes a sudden cardiac death. So I don't know if they had a heart attack or if they had an arrhythmia. So what you actually would just say is hypertensive cardiovascular disease is the cause of death, because that's the underlying disease that either caused one of the mechanisms that we don't really know which one it is that killed the individual. But that is very confusing to some physicians because they don't have the training that we've gone through. And then on top of that, we have manner. And that's where we've talked about natural. So there's only 5 manners: homicide, suicide, accident, natural, and undetermined. So, again, a regular physician can certify death in any known natural cause. A medical examiner is required for the others.
Okay. Wow. You just went right through that. That was awesome. You have to, in some cases, I would imagine it has to be an intricate little puzzle to solve.
It is. And actually, I think what people forget is that even though, I don't have living patients, it's still the practice of medicine. And what is the first thing that a doctor does when you go to the doctor? They ask your history, right?
Yeah.
So autopsy alone very rarely can give you the whole picture. It sometimes you can be sure about the cause of death, but manner, it's the totality of the events surrounding the death. So you have a gunshot wound of the head. Is it a homicide or is it a suicide? Or is it an accident? The events surrounding what happened are vitally important and still important, even in somebody who is no longer living. It's still the practice of medicine. And so, when you had Wendy on, our death investigators are so important because they are the ones that go and get us the history.
Wow, what she did, and when she was talking with Bertha, oh my gosh, she's an investigator as well.
Yeah. So she goes to the scene and takes photographs. Sometimes we'll get the law enforcement photographs, any of their, investigative reports, the run sheet from the emergency medical services or EMS when they transport somebody, what was their rhythm when they saw them on the EKG, all of those things are important. And I think it's important to know because I think sometimes, especially with so much interest in forensics and CSI television, families get unrealistic expectations. It's hard to give preliminary autopsy findings because every little puzzle piece could change, and you don't want to say something, oh, well, your loved one died from, high blood pressure, the hypertension, and then you get the toxicology back and it's a drug overdose. So
that would be like, excuse me, but I made a little bit of a mistake here.
Yeah. So understanding that, even though it may take a long time, the reason why it's challenge, you can't look at it just in one aspect of it. It's the totality of all the findings together. And sometimes that takes time. Believe it or not, we struggle getting, even though we're not bound by HIPAA, we struggle getting medical records. Sometimes, the hang up is we need the medical records. The person was in the hospital for many weeks and we need to see exactly what was done.
And that's difficult for you?
It can be.
You would think that would be so incredibly important.
It is. And so that's why, right, it's not just the autopsy alone. It's, I've had cases where, it's a delayed homicide. So they were shot and then they died several weeks later and they had multiple surgeries, and, the exact wound track is no longer there for you. You're trying to figure out these healing wounds. Are they entrance? Are they exit? Did they remove a bullet that was already turned over to law enforcement? So, it's not just as simple as what did the autopsy show?
Yeah, because, TV has, okay, the deceased comes in, the medical examiner, forensic pathologist, or depending on where you are, coroner comes in, they do, a procedure, everything's solved. It's so not that.
Yes. Yeah. I mean, the biggest limiting factor for us right now is toxicology. It takes a long time to get those results, but part of it is because we have so many drugs that are being abused right now. They have to test for a lot of drugs. Forensics also has a higher standard, a higher burden of proof. So if there is anything positive, we have to confirm by a second different method. So, it takes
Explain that.
So it takes a lot of technical work. So there are different chemistry machines that can run and test for, things in the blood. And if it's positive by one method, then they have to do a second different method. So it's just like the technical aspect of how they do it. If they use mass spectrometry or time of flight, there's a whole different, there's many different ways to test, and they have to confirm by a second different method. And so it takes a lot of technical work, and that's why it takes so long. I think it's also
what is and I can't say an average because it all depends on how much stuff they find in a person's system, but because I know I've had, at some point, I think a lot of people watching, listening have suffered the loss of a loved one and or a friend, and everybody says, well, they're waiting on toxicology. Wait, it seems to be forever. And is that because if there is a positive, then there's a second test? It's just an intricate procedure based on what they're finding, and that could take weeks, months.
Yeah, I mean, the standard is to have 90% of your non-challenging cases signed out within 90 days. So that's 3 months, and that's a lot of time to wait. Some places don't even issue like a preliminary DC, death certificate. Here in Florida, we'll do a pending if we're waiting toxicology for certain deaths. We still run toxicology on cases like a motor vehicle accident, but we usually that day sign out the cause of death, because for us, the toxicology wouldn't change it, but it's still potentially important should some criminal charges be assessed to a survivor or whatever remaining in it. But for the cases that are potentially drug overdoses or suspicious deaths where you want the toxicology, it can take a long time. Part of it is there's so many more drugs to test for now.
That's what Wendy, the medical legal death investigator that was on, said, that there's new. So sometimes they don't even know what it is at first.
Correct. I think, and that's kind of where it can be really tricky, because you have a case and you're expecting it to be an overdose and you're not, and then you get the tox back and it's negative. So then you make sure you've put in sections to look at under the microscope to make sure there's not some natural disease process that you can't necessarily see. Like sometimes you might not necessarily feel the pneumonia when you're looking at the lungs. But if you look at it under the microscope, you might see the pneumonia. There might be something going on with the heart, like an inflammation of the heart called myocarditis that you can't see, but you might see under the microscope. Sometimes we will get if there was any paraphernalia seized at the scene, and then we'll test that to see if what that comes back with is something that our lab can test for. And I think the challenging part is that people don't understand is we can't just put it through a system and say, okay, what is it? We have to direct our testing to what we think might be there. So people think, well, you tested. It's like, no, you have to specifically test. It's not, okay, let's just put it in and everything that's in that blood is going to pop up. Correct.
No, and that's why sometimes, any diagnosis, whether even if you're alive, if you're not testing properly, you're not going to get the proper result.
Yeah, and at some point you may potentially even run out of your specimen, and so you have to be judicious about what you test for. Every drug use is regional, so we test for the common things seen commonly here, but new drugs do emerge, and so that's kind of where you might find them if you start ending up with a lot of cases where you're expecting them to be a drug overdose. It looks like a drug overdose and you're not getting results. So what are you missing?
Yeah.
I had a case a few years ago and it looked like a drug overdose. And it came back with just a little bit of Xanax that shouldn't have been enough to kill the boy. And his family really wanted the case signed out. So I signed it out. I can't remember if I undetermined it or I said, probable overdose of undetermined substance accident and or undetermined. And the family didn't like that because, right, they wanted an answer.
Yeah.
So they did some digging in his cell phone and they found something called Kratom. That's a fairly newer drug.
Never even heard of it.
I believe it's popular in the Far East. It can be used as like a tea, but it is an interesting drug in that at low doses, it acts like a stimulant. So like cocaine or methamphetamine. So it's, stimulants are uppers. So you think, it's going to increase your heart rate. It's going to, make you sweat and, everything's going to increase. Whereas at high doses, it acts like a respiratory depressant. So the respiratory depressants are like alcohol, the opiates, the benzodiazepines, which includes Xanax. And if you think about the depressants, right, they do the opposite. They depress. So they decrease your heart rate, they decrease your respirations, and then eventually you get fluid on your lungs called pulmonary edema, and then you die. So, our lab could not test for that at that time. So we had to send it out to a reference lab, and they found kratom. Now, there weren't a lot of cases known to cause death at that time, but in combination with the Xanax, it was enough to have killed him. And so that's just an example of where, we can't just test for everything, unfortunately. And I also think it's important to know that, urine drug screens are very fast in the hospital, right? But they are qualitative, not quantitative, right? So it just tells you this is present, this isn't present, yes or no. If we also think about urine, right, it's the waste. We're getting rid of it. It's metabolized. It's useful in some respects to show what has been used. Sometimes heroin breaks down very rapidly, and sometimes if you have byproducts of heroin metabolism, you might have a different one in the urine that helps you suggest that it's heroin. But I want to show that it's in the blood, and killed the individual. So the blood is actually what's more important to me. And then again, that has to be, if something's positive, it has to be verified by a second method. So it just takes a lot more technical aspect, and it's not like the hospital where you go and have a urine drug screen. So.
My goodness, Erin, you have your work cut out for you. You know what I'm saying?
Spectrometry.
Yes, I always say it wrong. Now, you're more microscope. Do you do that?
So I don't do that technical aspect of it. Now, the chemistry lab is part of pathology. So potentially, if you had interest and you are a forensic pathologist, you may try to, do more of the technical aspect. But, I don't have the additional training. We learned how to interpret the test during residency from the chemistry lab, but we never, weren't in the lab, doing the very technical aspects of it. So we have a toxicologist, and the toxicologist primarily are all PhDs who have done a PhD in chemistry and then have done forensic toxicology as well.
Okay. So but you spend a lot of time under the microscope.
Correct. And then we still interpret. We have to be able to look at the toxicology report and say, okay, yes, this killed the individual. Where it gets really tricky is, how intoxicated is somebody?
Their weight, their tolerance.
We can't look at a value and say this is how intoxicated the person is. Alcohol, we have a legal limit for driving, but if the person is a chronic alcoholic, that level that may be lethal in an average individual may be what they walk around at. And so I can't look at a single value and say how intoxicated an individual was from this. I had a chronic alcoholic who got into a vehicle, drove, he ended up crashing and dying, but he had a 0.6. So, 8 times the legal limit of driving, where most people are dead at a 0.3. So, you can't look at a single isolated value and say definitively how intoxicated somebody is by that. Sometimes we have levels of drugs that aren't significantly elevated, but you have somebody who is dead, who shows signs of pulmonary edema with drugs nearby. And so while the level doesn't seem like it would kill the normal individual, for whatever reason, the scenario suggests in this case, in this time, this is what killed them. Sometimes I had a family member, they didn't understand their loved one had done crack cocaine his entire life. So why did he die this time? Well, cocaine the stimulants are cardiotoxic. They typically cause an arrhythmia. And for whatever reason, this one time, an arrhythmia occurred with the heart. I can't say why this time, but this time is the time that it happened.
So when you're talking about, there's different levels of intoxication. There's different levels of, toxicology, drugs in your system. Nobody's all the same. It's not this amount of drugs can kill somebody because that amount of drugs may not kill this person. Do you find the same when you're looking at disease, that certain people can have a larger amount of disease and have it cause death, or certain people could have less and have it cause? Does that change also?
Oh, certainly. Some people you'll have walking around with, who are younger and have very significant narrowing of their coronary arteries and their heart. And you can't believe, that they were able to walk around normal for so long, but they died from some other reason. It goes for everything though. It's kind of, there aren't absolutes. I've had gunshot wounds where there was a significant injury to the aorta, which is the biggest artery in the body. It takes blood from the heart out to the rest of the body. And the individual ran 100 yards after he was shot. And most people would say that would be a fairly rapid death and you wouldn't be able to run after that injury. Well, he did. I had a woman who was shot in the chest, and she had a significant injury to one chamber in her heart. And she was driven to a hospital that was not a trauma hospital. They transported her to a trauma hospital. She arrives in the ED, awake, talking, saying that she can't breathe, and ends up not surviving, but she survived for an hour with a significant cardiac injury that most people would say would be rapidly fatal.
Why would you say something like that happened? Is it just one of those things, or?
I think probably what happened is she probably had a clot blocking. So it was in one of the atria, which are the smaller parts of the top of the heart. And I think she probably had a clot blocking the hole. And I think when they, obviously they are going to try to aggressively resuscitate you because she has a gunshot wound of her chest. And I think eventually probably the clot got knocked off, and they just weren't able to revive her because it was a significant injury. But I also think, we can give, what is expected, right? That is not an expected survival time. But I always hate that question when you're on the stand, because they want to go for, pain and suffering. Well, how long would they have survived? Well, how long is a piece of string? I mean, we can give generalizations, but to know for sure, we would have to, have a video. There's nothing that's absolute. Because every time you think it could never happen, you get some crazy story about something happening that you just don't feel like could ever happen.
Yeah. Now, that was one of my questions when you said testify. So part of your job, and I would imagine, you have to testify in court. Are you testifying because it's an insurance issue? Are you testifying because it's a criminal issue? Are you testifying because the family thinks there's some kind of wrongdoing, or all of the above?
All of the above. So we do, we testify in homicides. If the suspect is captured and, going to face criminal charges, we'll be brought in as the expert who performed the autopsy and to talk about the findings. We're not there to say this person is guilty. We're just there to talk about what I found at the autopsy. And then basically a lot of times at the end, they ask, okay, what's the cause and manner of death?
Okay.
There are times when we testify for criminal cases as well, or civil cases as well. I'm sorry, there are also other cases besides homicides, motor vehicle accidents. For the most part, we call them accidents unless, somebody intentionally drives somebody over.
But that's not an accident.
Yes. Yeah. Where that would be a homicide. But for the most part, we call them accidents. Now, the other driver may have been intoxicated and they may get charged with like vehicular homicide or, any of the other charges that they want. We still call it an accident, but we potentially go and testify as to what we found at autopsy.
Okay.
Like that. Sometimes there are civil cases, and it may just be a deposition, not an actual trial, where they just want to get your statement under oath. Maybe they're trying to settle out of court. I've had those for motor vehicle accidents. I've had those for, a family was suing the city for a police involved shooting. It didn't end up going to trial, but it was a deposition where I had to, give the findings found at autopsy. We can testify in all those cases. Some medical examiners choose to be expert witnesses.
And what makes it a witness to an expert witness?
So technically we're still experts, but they tend to use us more as like a fact witness. Although technically we're still using our expertise to say what we found at the autopsy. And a hired expert witness may be somebody who, might have additional training or be considered, one of the best in the country regarding, say, like a child abuse case. Those can be very challenging sometimes. Sometimes the defense or the prosecution may bring in somebody who is a child abuse expert, potentially a forensic child abuse expert. They may bring in somebody who has additional training for the brain called neuropathology to testify, and they can, charge whatever they want to charge for their expert testimony. Whereas when I'm testifying on a homicide that I did for Broward County, that's part of my job. So I'm not charging them my expert fee. Whereas if you want to do additional consult work, or some people only do consult work, where, you are considered an expert and cases are brought to you, that's something else.
All right. Wow. I'm like getting questions as you're talking. So now I got to try to remember what I was going to ask you. So I would imagine to be an expert witness, you have to have a certain amount of time or experience under your belt. So does some people sometimes go from being a forensic pathologist to an expert witness? And then that's like you said, that's all that they do.
Yeah. And sometimes those people also still do autopsies. They are just not like a county employee or a city employee doing them for the city. They are doing them on their own, in their own, whatever they want to call their LLC, and performing them as an expert. Some people who do forensic pathology fellowship don't ever go to work for, government, or in a jurisdiction where they're performing autopsies for, wherever they're living. They actually just do private autopsies and potentially, work on becoming an expert in whatever area they want. So,
okay. Hello, everyone. I hope you're enjoying our episode of Forensic Friday with Erin Eli. She is a forensic pathologist, and boy, did she go into a lot of detail in part 1. Well, be prepared. There's a lot more coming in part 2. Can't wait to see you in the next episode.